What's going on, guys? Peace. Let me try to make this as quick as possible. Yeah, so this is not my house, by the way. This is my mentor's place. I'm only here for the food. Just kidding. He's gonna look at this like, what? She. But anyway, I'm a little sick also, so pardon. Oh man, the change in voice, but whatever. We're gonna go ahead and do this uh, quick update video. Last video I made was about 10 months ago, and I made that video after my first year of medical school and talking about those perspectives. And now I finished second year, and I'm gonna give my perspective now. So time flew, and I'm gonna try to give quick, cut and dirty, and try not to make it too long. Yeah. But yeah, some people messaged me and they were asking, "Oh man, are you still alive? And are you still in med school?" I'm still here. I've just really been grinding seriously. Like, one of my this one faculty at the school said it the best. She said, pretty much first 2 years of medical school, you will never have, or let me put it this way, you'll never have as much time to study as you will first 2 years of medical school. Why? The answer is simple, because after your second year of medical school, guess what you're going to be doing most of the time? You're going to be seeing patients until the day you die. She didn't say that, but pretty much, I mean, but like, the only time we're going to have to study is after seeing patients. And we're going to be tired and mentally drained, and we still have exams, and, even residents, same thing. So, even licensing exams after being a licensed physician. So it's the same thing. So once you said that, that gave me a clear perspective of, okay, first 2 years I need to just focus on studying, and whatever stress I have, blow it off so I can get back to studying. Classic bread and butter, work hard, play hard lifestyle. Um, so yeah, so let's see. So I um finished second year. So what that means is literally third year is gonna start next week. Third year starts next week. So literally next week we have orientation, and then right after that we start seeing patients. So that's gonna be exciting. Before that though, I took step one. Step one is the first part of the medical licensing exam in the U.S. So to get your medical license, to practice legally in the U.S., you have to take a series of 3 exams, and step one is the first part, and we took that. I took that, and you take that around the end of your second year of medical school, and it tests for all of the things that you learned in the first 2 years of medical school, all your anatomy, your brachial plexus, all your arteries, veins, all those clinical scenarios involved with that, your gastroenterology, your GI, renal, cardio, neuro, all of that, and more. But wait, there's more. Endocrine, reproductive, stats. But tested on all of that. So studying for that exam was hell, absolute hell. Look at my beard. Look at that. Like, I literally wake up, look at myself. I'm like, I'm fine. By the way, this lighting is kind of whatever, but I wake up. I'm like, fine. Go to school, study, knock as much questions out as I can, and feeling like crap because there's questions you get wrong. It's like, why did I get this wrong? Like, I literally went over this yesterday. Like, I got a question on multiple endocrine neoplasia. Literally reviewed it the day before. Multiple endocrine neoplasia is a compilation of cancers that are involved with each other. Um, so, for example, if someone gets parathyroid hyperplasia, and first you're going to see that clinically if they come to the clinic and you do routine lab work and you see that their calcium is high, see that their calcium is high, it's been high for a while, you're going to do a biopsy of the parathyroid gland, and if that comes back as hyperplasia or increased amount of cells than normal, first thing you're thinking about is, or you're thinking about, okay, I hope they don't have any kidney stones, and let me make sure this calcium isn't coming from anywhere like the pancreas. But also, let me consider multiple endocrine neoplasia. So what that means is compilation of other neoplasias associated with that, like pheochromocytoma, um, or pituitary adenoma. Ooh. But I got a question on it, and it's just the way they presented it was just, I could not, I didn't know where they were going, and I was just like, I just reviewed this yesterday. What the hell, Got a question on diabetes. Very simple concept. You have insulin sensitivity, and due to that, blood sugars are high, and the complications, diabetic or retinopathy and nephropathy, and but then they ask you about the alpha and beta subunits of insulin. It's like, what? Are you serious? But we have to know it. We have to know our basic sciences and all this nitty gritty stuff. Someone in the hospital has to be familiar with it, the physician, and that makes sense, and it's all good. But studying for that was hell. One of my alumni friends said it the best. He said, any mental illness that a medical student has that's dormant will peak or has a high chance of peaking around the time of step studying, just because it's just crazy. But let me digress from that. I passed the exam. I didn't get the best score ever. I got below average. It sucks, but whatever. Because I moved on from it. The stress from taking that exam was just got to a point that when I got my score, I was just in such relief that, okay, I passed, and at least I don't want to do any very competitive specialty like otolaryngology or any of the surgical specialties. So that's fine. But anyway, I may be interested in OB-GYN, which has some surgery, but we'll see. But anyway, I took it, I passed, so that's done for it. So I'm gonna start third year 2 weeks from next week, and my first rotation is in OB-GYN. So that's gonna be interesting because I'm interested in OB-GYN. We'll see. So obstetrics and gynecology. Obstetrics is pretty much taking care of pregnant women from the time that pretty much the time that they receive prenatal care or are thinking about pregnancy, and to the point that the baby or the neonate is born. And gynecology is pretty much taking care of women who have their issues of the reproductive tract, and also hormonal issues with the breast as well. Breast cancer is a big topic. Not all masses of the breast are cancer, but you should always suspect so. But so that should be interesting. Let's not make this video too long. But yeah, and that's pretty much it. I don't think I'll be making videos throughout rotations, but we'll see. My main thing, just like my friend has given me a perspective on, is that she was like, you're a black male, and there aren't a lot of black males who are in medicine. There aren't a lot of black males in medical school. Or she was saying there aren't a lot of black males applying to medical school, and some of them want to, and they just don't see. It's hard because they just don't see a lot of black males who are in medicine, and when she was saying like if they see someone like me, they could have like a point of reference. Oh man, if he's doing it, I could do it too, and that's huge because I was in the same boat. For example, in our school, including myself, there are only 2 black males in our class out of 120. Can you believe that? I digress from that statistic. But anyway, I'm just giving my perspective, and I want to keep going, and I hope you guys are doing all right. I don't want to make a long video, but whatever. It's done. If you have any questions, message me in the comments. I'm more likely to respond in comments than Facebook, because Facebook has become a huge distraction. I'm rarely on it as well. But anyway, I hope you guys are all right, and take care and peace out.